It is my great honor to speak to one more incredible doctor, surgeon in aesthetic medicine, a good friend of mine who's been coming to Tank for many, many years. And I'm so glad to welcome him to the Infinity Podcast, the special edition of the Infinity Podcast at TAMC 2025, the eighth one, the Infinity TAMC here in Dubrovnik. So I'd like to welcome my great friend and great expert, Reha Yavuzer.
Thank you very much for the introduction, my friend. You have been doing such a great job with TAMC, so it becomes a irresistible habit for all of us to come back.
I know, and I'm so proud that you're here because I know that you were invited to a couple of other things at the same time, and you wrote to me and you said, "Are you counting on me?" I said, "Yes, fine. I'm canceling everything else."
Yeah.
And I was so proud and humbled that someone who's such a great expert and teacher and one of the biggest KOLs for Allergan for many years now, and an incredible surgeon in Turkey, that you come and you support us.
Well, it's not just for you. There is a specific reason for this. Maybe you are so into this, you can't really realize what you have been created over the time. This is not only friendship. This is not only science. This is not only fun. This is a huge chance of very humble, joyful experience change for all of us. So every single time whoever comes here, while going back, definitely has multiple things in her bag or in his bag, which is very important. You can't find this with every single meeting.
Yeah. When you say it's something in their bag, it's knowledge, it's fun, it's friendships. You're right. We tried to just make it a very simple and nice Congress. And of course, with it to be a lot of fun in great places. And we have KOLs such as you. I think a doctor just here in the corridors of the hotel stopped me and said, it's my favorite Congress because you have the best speakers, the best science, and it's a much better size than an IMCAS or somewhere else where you can talk to the doctors afterwards, learn the pearls of wisdom and so on. Tell us, which pearls of wisdom will you be sharing with our audiences at TAMP this year?
Well, this year, it's a very busy program that you created. So there are tons of interesting knowledge and information coming in. Aesthetic medicine in general is growing. When it is growing, it's also changing though. So the demand is increasing, but also the expectation as well. So we need to fulfill this responsibility. Every single day, we need to learn more, execute more, and combine things in a better fashion so that our beloved patients will benefit from that. So in the TAMC this year, every single item of treatments has been recognized and involved. And also then there are great panels that you created, which are really discussing a variety of aspects of certain areas. So I don't want to go in details, but this year we'll be talking about injectables, biostimulators, energy-based devices, even surgical aesthetics as well, and what is the limit of surgery and when to go for non-surgery.
Exactly. And where is the limit? There's been a big trend on TikTok, especially, where suddenly the comeback of the deep plane facelift and the facelift is here. Of course, for many years, we say, "Oh no, you must have fillers and Botox and so on." Is the truth somewhere in between? Should we be collaborating and doing both for our patients when it's indicated?
For sure, of course, fashion and trends has a big impact on us. But, there are anatomical realities, there are aging process, which we tend to limit. Every single year, we also discuss a lot of stuff regarding longevity as well. Still, we need surgery, but day by day, unfortunately less. Why unfortunately? I'm a plastic surgeon. I want to do surgeries. But, with the ability that we gain with a variety of injectables, but most importantly with energy-based devices. Now the technology is crazy out there. So there are so many different type of energies. They all look like laser devices for our patients, but their abilities, their depth, their purpose are so different. However, that puts us in a difficult shoe because we really need to sit down and study. They're very clever devices, and in order to use those smart devices, we have to be smart enough as well.
I know that you teach a lot on high-phase technology. I think you teach a lot on RF microneedling as well, and a lot of different. Could you tell us about two or three really interesting modern energy-based devices which you would recommend even for our patients maybe who are watching?
Well, first of all, there are certain new devices coming out on the market, which is, very nice to explore because that really opens up new treatment modalities. For example, 5, 6 years back, we weren't really thinking about improving the muscle tone on our face. Today, we know that the HiFest device that you mentioned can able to increase your muscle tone, muscle hypertrophy, and through that, help with the bone loss as well as collagen production. Wow, that's a kind of a very interesting innovation. On the other hand, there are certain energies that has been on the market so long period of time, like 25 years, 30 years, like broadband light, And when you look at those, the newer platforms provide better energy, quicker, less pain, much quicker recovery, and a higher output and outcome as well. So combining the old and new, now layer by layer, we able to address the needs of the patient. However, still doctor is so important. Injector or technician is so important because that comes down to the consultation. That comes down to the assessment. If you put the right diagnosis, if you do the right assessment, then that is the time that you can create a treatment algorithm with the knowledge all of these that we have been gathering from congresses like this one. Then execution is an issue as well. Once that has been done, following up that patient and then taking them through the time is important. Why it is so important? Let me give it data. Back in 1800s, the mean average age was 30 years old. From 1800 to 1900, over 100 years, over a century, we gained about 10 years. So the mean age increased from 30s to 40s. What happened to the next 100 years? From 1900 to 2000, we gained 30 years. So we tripled the mean age of gain on the second century. What about the next one that is coming up in front of us? God knows.
Another 30, another 100.
Right. So that means that we need to really take care of ourselves.
Absolutely. So what do you think? I mean, a long time ago when we both, I'm not a surgeon, I'm a pure aesthetic medicine doctor. So 20, 30 years ago when we first started using toxins and hyaluronic acid, yes, we had some microneedling, we were maybe using PRP, but we didn't have so many biostimulators. In your practice, is it still, as far as injectables are concerned, is it mainly still toxins and hyaluronic acid, or is it more and more now biostimulators?
There is a big change because the change is happening. Our understanding and knowledge is changing. Now we respect the bone. Now we respect to the muscle. We know how to keep the fat tissue in its position. We know the skin quality is important. We know all these require a holistic approach. And at the end of the day, we need to make the body produce the right products for us, which comes down to the biostimulation. And then the biostimulation is a very general vague term. We further need to deep dive into that. Superficial, deep, what layer, which area. And then by that, definitely a new window opened in front of us. As you said, 20 years back, we didn't that kind of a knowledge. We didn't, that kind of an experience. But today, it's a different world. So being old school, ethical-wise, is very nice. However, when it comes to the techniques, devices, methods, we need to be extremely new school.
Yeah, absolutely. Because, a long time ago, we were just chasing nasolabial lines. I used to fill glabellar lines with a needle. We weren't using any cannula. It's become a different world. And I think with edge-based devices, with the laser resurfacing fractional technologies and so on, we can do so many incredible things. And, even things like plasma energy for upper blepharoplasties and so on. I think there's so much we can do. But is expertise and learning important? I don't know what it's like in Turkey, but there's so many illegal people who've been on just one course and they're doing it. That's why it's so important. You teach so much, and we teach the anatomy so much. I think that's so important. Is it a big problem? Is it what's actually, because there's been a recent trend to really criticize dermal fillers. And yes, it's got its small problems, especially if not done properly. To me, it's still the best tool in my box. Is it more the unskilled and illegal people who are giving us the bad name?
I can't agree more. Of course, this is a kind of very commercialized area. That is why so many illegal people, untrained, unofficial, unethical people are practicing. And our patients are not really aware about this too much because the social media is so powerful and there's no filter about it. And whatever you see on the social media, you don't even know that even it is true.
Exactly.
That creates a big problem. So we all know that not every single filler is the same. Not every single injector or doctor is the same either. So we really need to know what is being done to you and who is performing that at what place. So black market, quote unquote, in the aesthetic field is unfortunately growing very rapidly. You have to be very careful. And I think at that point, the main responsibility is at the society, at our patients. They really need to be very careful. They shouldn't be just got a motivation from a picture and run and perform something that they might be regretting for several years. Because you and me, we have been dealing with a lot of complications as well. And then, as you so well said, fillers is very important. Why? Because as we age, we are losing volume. So how are you going to replace that
It's
volume?
the only way, really.
With biostimulation, you can achieve certain thing, but you have a limit. Still, the volumization that you need is going to go through the fillers. Yet, with good quality and with the knowledge of anatomy, with the right proper techniques.
To go back to the before and after photos and even videos, and we see these incredible transformations in Thailand where they look 50 years younger, which is ridiculous. They're putting some filters on there. People putting different positions and lighting to get results. Some esteemed colleagues, I think, I see maybe doctoring some results, unfortunately. But in Australia, I think it's banned, right? I think before and after photographs are banned. You're actually not, I think I'm right in saying this, you're not allowed to use them in your advertising, on your social media. I think that's right. I think we're going towards, now when I turn on Instagram or TikTok, I'm not sure things I'm seeing are real or not anymore. And that's only just started, isn't it? So I think we're running into trouble with that, aren't we?
That's a very big issue because the technology in that area is growing so rapidly. And those bans in certain countries, for example, in Turkey, the pre and post pictures are banned as well.
Oh, they are.
But it's all over the place.
Yeah.
So unless you really report, nothing gonna happen. And even if you report, well, I can bypass the rules easily.
Yeah.
So at the end of the day, if you want to consume aesthetics, you have to be careful. You have to know your doctor. You have to know the clinic that you're going. You really need to know the product that is going to be injected to you.
Because there's so much stuff on the black market, even the products are being copied, aren't they?
Because on one hand, there are many physicians and injectors practicing around the globe, but many of us know each other. So we are one single global society. We can easily send our patients to each other and saying that, oh, are you in Croatia? Go so and so. Are you in France? Go so and so. So, we can cover all those patients in a very safe manner. And meetings like TAMC is creating that kind of global networking and friendship.
Exactly, Reha. When people say to me, do you know anyone in Turkey? I know exactly who I recommend. But how has Turkey become this global phenomenon for medical tourism, for aesthetic tourism?
Well, there were certain foundations that created that. I must say that we haven't able to use it very properly, though. For the last few years. However, if you dig into the reality why it is young society, when it comes to the aesthetics, especially for plastic surgery, many of us goes to US for either short period, long period of time. For example, I spent about 5 years in US and then come back home and start practicing. So that creates a foundation of training and education. On the other hand, government for the last 10 to 15 years spent huge amount of investment to the hospitals. So very high tech, very beautiful hospitals, both in the government setting. And to cope with that, the private sector also grow in the medical field as well. So that create another foundation as well. Then having the Istanbul, having Turkish Airlines flying all over the world.
Great airline, great city.
Also brought a great
A lot
aid.
of people.
Yet, you have to be careful. So just like what we were talking about, They're low budget, gray zone areas, which you can end up with terrible complications that you will definitely regret for the rest of your life.
Cheap is not necessarily better. I mean, I'm quite expensive, as I'm sure you are. Cheap is not necessarily better. In fact, I think you have to be careful when the prices are too low.
If you want to travel for medical tourism, travel for not for price, for expertise. The main reason should be that.
Yeah.
Because we all know that if you want to get a certain treatment at a certain quality, there's a amount of investment that needs to be done. And then on top of that, the margin for the physician is not that big at all in any country. So if you found something too good to be true, believe me, it's not true.
Yeah, no, I completely agree. I want to get back just one more step before these podcasts can't be too long. I've been told they have to keep them quite short. Getting back to knockoff fillers and fake fillers, is it on the market something like M-Face, which I love, the high-face technology? There are cheap copies on there, and what's really frustrating is the false advertising. Fine, it could be a nice little machine which kind of does something as well. I'm not saying it's the wrong machine, but they will put M-Face. Or they won't get an M-Sculpt Neo, they'll get something else. They will say M-Sculpt Neo. They won't get a cool sculpting, they'll get something else, they'll put cool sculpting. And this is very frustrating, and it's something that needs to be policed as well. But it's very difficult on the internet to police this, isn't it?
I think so. That's why, the responsibility comes down to the society, to the potential patient. They need to go to a credible clinic, credible doctor with the, right education and training and experience who's going to cover them for good. Otherwise, you can end up with a device supposed to be cat copy of another device. You can end up with no result. Hopefully, that would be the best outcome, or potentially certain complications. Same thing applies for the injectables as well. And you cannot really ban people from producing cat copies. There's no regulations regarding that. So we have to be careful. And I tell to my patients that, you know what, when you're buying a car, when you are buying, any device, you want to buy one of the best so that that can be run for a long period of time. Even when you're buying a tomato for your salad, you don't take the bad one. You get the best one for your own salad, which is just going to be used for once.
Exactly. So, 2 more questions for the end. One, do you have any advice to young aspiring plastic surgeons and doctors how to get ahead in the aesthetic field? And secondly, what are your expectations for the next 3 fantastic days at TAMC 2025?
Well, for the youngsters, first of all, they shouldn't be disappointed or depressed at all. The future is so bright. Every single year, almost 2-digit growth is happening within the aesthetic field in multiple areas: longevity, non-surgical, surgical, energy-based. So, very bright future for them. Yet, they need to collect the experience. So, pick up a mentor. Stay with that mentor for some time. Learn the real stuff, not the fake stuff. Wait to build up that experience. And then if you want to fly away, you can fly away. But the better the team is, the better the, potential outcomes that you're going to have. So team management and team player is going to be much more important than solo practices and, one-man show type of thing.
Yeah.
Then the second advice for them is definitely attend pure, genuine meetings like TAMC. Why? Because on the stage, everybody is humble, everybody is honest, everybody is telling what they believe that it is true, and discussion is open.
Yeah.
So, that is very important. What we're expecting from the next 3 days? Well, I'm sure we're going to have fantastic times at nights with lots of parties, but more importantly, we have beautiful anatomy sessions. Anatomy. Unless you know your anatomy, you can't achieve an outcome. Then, with all parts of the injectables, whether that's toxin, neuromodulators, fillers, which are very important how to use it, are going to be addressed in these, over the next 3 days. Moreover, we're going to have the energy-based device sessions. And as I said, to know the limit of the surgery, non-surgery is very important. Yeah. Even if the person is not a surgeon, he or she should know when to send that patient for a facelift, for example. Or where is going to be the limit of non-surgical approaches? On the other hand, for a surgeon like me, as I learned over the years, I should understand that not every single thing is going to be solved by knife.
Exactly. Thank you, Reha. It's been an amazing podcast. Thank you so much. Thank you for coming once again. Ladies and gentlemen, the great Reha Yavuzer. Come and see him. If not at this year's TAMC, definitely future one and all over the world. Thank you. Thank you.
Thank you very much.
Thank you.